The gut health conversation has moved from the margins of nutrition science into the center of mainstream health culture. Probiotic supplements line pharmacy shelves in bewildering variety. Probiotic-enhanced foods appear in nearly every category of the grocery store, and social media is saturated with content promoting the gut microbiome as a root cause of everything from digestive discomfort to mood, immunity, and chronic disease risk. In the middle of all this, a genuinely practical question gets lost. For someone who wants to support their gut health, is it better to eat yogurt regularly or take a probiotic supplement? The answer depends on who is asking, and understanding why requires a clear picture of what probiotics actually do and how these two sources differ. What probiotics are and what they do. Probiotics are live microorganisms that, when consumed in adequate amounts, confer a health benefit to the host. The gut microbiome, the vast community of bacteria, fungi, and other microorganisms living in the digestive tract, is intimately involved in digestion, immune function, production of certain vitamins, regulation of inflammation, and even neurotransmitter signaling that affects mood and cognition. Probiotics help maintain and restore the diversity and balance of this community. But probiotics are not a monolithic category. Different bacterial strains have different effects on different conditions in different individuals. Lactobacillus rhamnosus GG behaves differently from Bifidobacterium longum, which behaves differently from Saccharomyces boulardii. What works for one person's digestive issue may have no effect on another's. This strain specificity is one of the most important and consistently underappreciated facts about probiotics, and it is the reason that sweeping claims about probiotic supplements as a universal solution to gut health problems are almost always overstated. What yogurt provides. In the United States, any product labeled as yogurt must contain two specific bacterial strains, Lactobacillus bulgaricus and Streptococcus thermophilus. These live and active cultures help maintain a healthy balance of gut bacteria and support digestive function during regular, long-term consumption. The key phrase is regular and long-term. Yogurt's contribution to gut health is best understood as a steady, consistent input of beneficial bacteria that supports the existing microbiome over time, rather than a targeted therapeutic intervention. Beyond its probiotic content, yogurt provides a nutritional package that supplements cannot replicate. It delivers protein, calcium, phosphorus, potassium, B vitamins including riboflavin and B12, and in the case of Greek and Skyr-style yogurts, a particularly concentrated protein content alongside fewer natural sugars due to the straining process. These additional nutrients make yogurt a meaningfully different choice from a supplement containing isolated bacterial strains. The most important variable in yogurt selection is added sugar. Many commercially available yogurts contain substantial added sugar, which can counteract the gut health benefits by feeding less desirable bacterial populations and contributing to inflammation. Plain Greek or Skyr-style yogurts with live and active cultures and no added sugar represent the strongest choice for gut health purposes. Flavoring with fresh fruit, berries, or a small amount of honey provides natural sweetness without the concentrated added sugar of commercially sweetened versions. What probiotic supplements provide? Probiotic supplements typically deliver bacterial strains in much more concentrated doses than yogurt. Many products contain between 1 and 10 billion CFUs, or colony-forming units per dose, with some products ranging considerably higher. The assumption that more CFUs means more benefit is one of the most pervasive misconceptions in the supplement space. More bacteria is not inherently better. The relevant factors are the specific strains present, the dose of those specific strains supported by clinical evidence for the condition of interest, and the individual's gut environment and health status. Regulation is a significant issue with probiotic supplements. Unlike prescription medications, dietary supplements are not required to demonstrate safety or efficacy before reaching shelves. Third-party testing has documented cases where the bacterial strains listed on supplement labels were not present in the quantities stated, were absent entirely, or were accompanied by unlisted contaminants. This does not mean all probiotic supplements are unreliable, but it does mean that product selection requires attention to quality. Supplements that have been independently verified through third-party certification programs provide stronger assurance that what is on the label is actually in the capsule. When supplements may have an advantage. For generally healthy people without specific digestive conditions, there is no strong evidence that probiotic supplements provide benefits beyond what fermented foods like yogurt already deliver. Yogurt is the more practical, better regulated, and nutritionally richer choice for everyday gut support. The picture shifts in certain clinical contexts. People taking antibiotics experience significant disruption to their gut microbiome. Antibiotics work by killing bacteria indiscriminately, which means beneficial gut bacteria are affected alongside the pathogens being treated. Research suggests that taking probiotic supplements during and after a course of antibiotics can help preserve microbial diversity and reduce common antibiotic-related side effects, including diarrhea and digestive discomfort. In this context, the concentrated, specific strains in a supplement may offer more targeted support than yogurt alone. People with irritable bowel syndrome represent another population for whom probiotic supplementation has shown meaningful clinical benefit. Multiple studies have found that specific probiotic strains can reduce IBS symptom severity and improve stool consistency, although the response varies by strain and by individual. Other functional digestive conditions and certain inflammatory bowel presentations may also respond to specific probiotic protocols. In all of these cases, the choice of supplement matters. Consulting a gastroenterologist or registered dietitian to identify strains with clinical evidence for the specific condition involved is more likely to produce a useful result than selecting a product based on marketing claims or CFU count. Building a gut-supportive diet beyond probiotics. Whether yogurt, supplements, or both are part of a person's routine, the foundation of gut health is dietary pattern rather than any single food or product. A gastroenterologist's framing of gut health as the absence of disease conditions alongside a diet rich in whole foods and fiber captures this well. Fermented foods beyond yogurt contribute meaningfully to microbiome diversity. Kimchi, sauerkraut, kefir, miso, and tempeh all provide live cultures alongside a range of additional nutrients and bioactive compounds. Research has found that dietary patterns high in fermented foods increase gut microbial diversity, which is consistently associated with better metabolic, immune, and digestive health outcomes. Fiber is equally important and arguably more foundational. The beneficial bacteria in the gut need a food supply to thrive, and their preferred food is dietary fiber, specifically prebiotic fibers that reach the colon intact and fermentable. Chia seeds provide close to 10 grams of fiber per ounce, much of it soluble and fermentable. Whole grains like quinoa and brown rice provide insoluble fiber that promotes regularity and feeds diverse bacterial populations. Cruciferous vegetables like broccoli and Brussels sprouts deliver both soluble and insoluble fiber alongside bioactive compounds that appear to support colorectal health specifically. The cumulative message from gut health research is consistent and relatively simple. A diet built around varied, whole plant foods, fermented foods, and adequate fiber creates the conditions for a diverse and resilient gut microbiome. Supplements may serve as useful tools in specific circumstances, but they are additions to this foundation rather than substitutes.